Well, contrary to stereotypes about aging, dementia is not a normal part of getting older, but it can be difficult to determine if an elderly person has true dementia or if the symptoms are caused by other medical conditions or even depression. And that's why we have a guest here joining us today to talk about it, a nurse, Sharon Gauthier. Now, thank you so much for being here this morning.
You're welcome.
I did not realize that dementia was a mental illness. Can you talk about that a little bit?
Well, I think we need to start looking at it that way. It's not your normal progression of aging. There are people who are in their 90s who don't have any kind of dementia. Although there's some decline in your memory as you get older, dementia and Alzheimer's that are very similar is truly a condition, a disease, a mental illness. I think that impacts families and individuals and very difficult to identify.
Sure, and so that's part of the reason why we're talking to you.
Right.
Sometimes dementia can be confused for other things or vice versa. Why is that so common?
Well, I think that with dementia, especially early dementia, if an elderly person has a routine at home, it's very easy for families not to pick up on there's a problem with their memory. And usually it will come out when there's a crisis. So someone falls, something happens in the home, and then that's normally when the memory issue kind of shows its ugly head and people understand that they have dementia. The other thing is that urinary tract infections very much mask behavior. So someone could have a urinary tract infection, but usually that mental status change is very quick. So that wouldn't necessarily be dementia. So someone could have an ongoing urinary tract infection where there's a mental status change, but it's a pretty fast one. And being an old DR nurse, anyone elderly that came in with that report from families, we would immediately do a urine on them, which means they would come back to baseline. So that would not be considered dementia.
I can imagine as a loved one or a caretaker, that can be really scary, not knowing what it is or, why your loved one is acting differently.
Well, yes, I think it is. And I think there's a normal defense mechanism that happens with elderly when families get involved. They think that they want to take over their life, and oftentimes the families do recognize but kind of poo-poo it away to aging, but need to understand that the normal progression of aging is not to get lost somewhere and not remember where you came from. They may not remember names, but would be able to remember names at a later point. But if you have a family member who you're concerned about their driving, you're concerned about them being home, they suddenly can't dress themselves, can't remember how to run a washing machine, or can't remember how to do a certain task, they really should look at that.
And not only look at it, but then how do you go about deciding, what path of care is the right one for your loved one? Can they stay in the home? Do they need outside help? How do you work that balance?
Well, oftentimes we get involved in a crisis, so when there's a concern about that, our company will actually do geriatric assessments, but a higher level is really needed to confirm that. So you certainly go back to your primary physician who's going to know that client or that person well. And then they have the ability to do some testing. Then it really should go to a geriatric psychiatrist who can do some more in-depth testing on them. And it doesn't mean that the person needs to be put away. It just means that there has to be a safety net wrapped around that person if they're concerned about them cooking or driving or being able to manage their household.
And how do you go about having that conversation? Because that can be really tense. Like you said, people can get very defensive.
Well, I think it's very hard to have the conversation, and it always surprises me how afraid adult children in their 60s are still of their parents.
I would think so.
The way I usually do it is, I just tell people that let's go to the doctors and have a conversation. Doctors are usually pretty good in identifying and just really talk about it being a memory issue. So it doesn't mean you can't have a conversation with them. You just need to realize that maybe they need a little bit of help, and it may be having someone drive for them, which is usually the higher level functioning item that is the most challenging for people. But it will never be easy to have that conversation with your parents, to bring them somewhere to get identified. And doctors are really good about having discussions with the person themselves and saying, look, this is a memory issue, and we just kind of have to help you through this.
Right, and for that child, it's also about having that realization as well. That's difficult for them.
Right. And I always encourage families, please, if your loved one is driving and you have concerns about it, there are a lot of outlets right now with AAA that you can go to and they can do an eye exam, or McLean actually has a very extensive program that you pay $250 for driving.
Thank you, Sharon. And these are some tips, right, or symptoms rather, of dementia on our screen. Trouble with new memories, trouble finding words, struggle with familiar acts, like you said.
Correct.
Misplacing familiar objects, maybe like the remote or something, and then depression or irritability. That can be difficult too, to try and figure out whether or not it is depression or dementia. Some more symptoms: personality changes, loss of interest in things, seeing or hearing things, expressing false beliefs, and making bad decisions. Thank you for talking about this very important issue. It's something that we don't really get into that often, but with it being Mental Health Illness Awareness Month, I think it's good to just kind of open up this discussion about dementia, something that kind of gets lost in the fold sometimes, I think.
Correct, and I think hospitals are starting to look at this more because entering the hospital environment is tough. There is no cure for dementia, but there are medications that can keep them from it furthering, and also to help maintain a better lifestyle and behavior.
Well, thank you so much, Sharon Gauthier. Some great information, some great tips. You look lovely in coral today, by the way. Yes, of course. For more information, you can always head to our website, WTNH.com, click on the On Air tab, and pull it down to the Good Morning Connecticut Weekend section.